Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, today, doctors, what I want to talk about is what happens when a patient has an undiagnosed condition in their life. What's the problem with having an undiagnosed condition? I'm going to tell you right now, it's rampant in the spinal injury space. Absolutely rampant. I spend a lot of time in this space, and I spend a lot of time consulting doctors because they're going to trial, they're going in deposition, and the first thing I ask is very simple. You'll say, "Hey, Dr. Kronk, I got this case. It's going to trial. I'm going to be deposed on it. I need your help. I'd like, I have some questions. Da 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 da." And it's like, the patient was in a high-speed accident. Here's the car. Here's this. These are the symptoms they had. And I always have the same simple question. Okay, let's start. Let's roll back this here for just a second. What are the patient's injuries? Well, the patient was in a high-speed accident. Good. Sounds like they had potential for injuries, but what are the injuries? Well, they had whiplash. Whiplash is not an injury. They had headaches. Headaches is not an injury. Oh, man, their neck was doing really bad. Okay, that's not an injury. Well, they had a neck injury. That's not an injury. You might as well say they had a body injury. They had a cervical sprain. Okay, that's great. That's a start, but that's no different than saying they had a lower extremity sprain. What part of the lower extremity was sprained? What part of the neck was sprained? Are there parts that were sprained more than others? Sprain is a ligament injury. So oftentimes, I can't tell you how many times, so many times, with so many doctors, the first question I ask is very simple. What were the injuries to the spine? And there aren't a good answer. Well, they had a disc herniation at C5. Okay, so what are the symptoms with the patient? Well, the patient has cognitive dysfunction. They have bad headaches. Sometimes they have blurred vision, and they have neck pain, and they have neck pain that's positional. Sometimes when they turn to the right, they actually feel a sense of dizziness. Okay, great. That's not a C5 injury. That's not a C5 disc. That's not caused from a C5 disc herniation. That's not what a C5 disc herniation causes. So what is the injury that's causing that? Now, that leads me right into when a person's in a spinal injury, guess what? 55% or more of them are never going to fully recover. And why is that? It's pretty simple. Because the condition is missed. The main condition that they have is missed. It's undiagnosed. It's not worked up properly. So if the doctor does not know how to work up the condition properly, the chances of getting a great result with that condition are low. If a cancer patient went to a cancer doctor that missed cancers with the patient and was treating one cancer when they actually had multiple cancer or multiple sites, well, then the treatment's not going to be that successful. It's no different here. It's no different in the musculoskeletal area. When the patient is not recovering from the condition, it's because a condition is not fully understood or known, generally. Generally, that's true, right? So in the spinal injury space, there's only three ways the spine injures. You either break it, you cause excessive motion due to damage to the spinal support ligaments, or you cause a herniation due to damage to the ligament called a disc. The spinal excessive motion injury is also a facet injury. Part of that injury is the facet injury. Now, if you know what it is that you're looking for those three things. That's the only thing you have to work up. If you think you have a fracture, you're going to work up a CT or an X-ray. You're going to pick it up on X-ray, you're going to pick it up on CT. If you think that the spinal support ligaments are damaged, you're going to do great stress X-rays. If you're going to want the upper cervical, you're going to do an A to P, open mouth, lateral bend, left and right. You're going to measure, you're going to have a company using FDA compliant systems, using, when I say FDA compliant, FDA cleared procedures. If they use AI, AI's got to be FDA cleared. If they're using some sort of a system to measure with, it's got to be FDA cleared. And you actually do that, and that's what you're looking for. You get an excessive motion output test, and it tells you exactly where the main excessive motion is. It tells you at C2 you have a 12-degree angular finding. You immediately say, okay, under just about every insurer's pre-surgical guidelines, that's a level of ligament damage that pre-qualifies the patient for spinal fusion surgery. Are they going to go into spinal fusion surgery right away? No, they're not. They're going to go to a trial of conservative care, and hopefully they're going to be working with somebody in the conservative care space that actually understands their condition, because that's what's going to give them the best shot for recovery. So what happens with a patient that doesn't have that? Well, they have potentially a lifetime of chronic pain, and they don't have, the biggest problem that they have is they don't know why, right? So they go around to doctor to doctor to doctor and saying, well, it's from your whiplash, it's from your whiplash, it's from your car accident, it's from this. All right, what is from the accident? What did that accident do to the body? And is that condition reversible, or is it manageable? In other words, can I do something with it to seriously reduce down the condition? And then can I support that with periodic procedures or periodic care? That's called supportive care. Or if it's elective, to prevent the condition from returning, it's maintenance care. So what happens though, the biggest thing that I know in training doctors for the last, I don't know how many years now, is when a patient sees the doctor actually has something on x-ray and knows what the heck they're doing, they feel a sense of security. They feel a sense of hope. They feel like somebody finally figured out what it is. Now, if the doctor's confident with what they're doing and they can confidently explain it to the patient, it's like a doctor encounter for that patient that they've been searching for. Because they've been searching for, and a lot of times they failed. They failed. They went to the medical doctor, they failed. They went to the chiropractor, they failed. They went to another chiropractor, they failed. They went to a physical therapist, they failed. Whatever their experience is, they took drugs, they failed. They bought stuff on Amazon, it failed. They tried exercises on YouTube, it failed. Right? So what they need is a doctor that understands the condition. Now that's the biggest opportunity that there is today. So when patients have undiagnosed injuries, I'm going to tell you, I teach doctors all across the country to go into law offices and explain this condition. Now I'm going to explain something to you right now. What I teach these doctors to talk about is this, right? So if I'm in an attorney's office, I'm going to talk about this ligament injury that's the non-disc. They know the disc, they just don't know the other ligament injury. They don't know the significance of the other ligament injury. They don't know if I go to Medscape and say, what's the clinical presentation of a disc? It only has two symptoms. If I go and say, well, what's the clinical presentation of a cervical sprain? Look at the difference in the symptoms. What is the difference? One is including the disc and the spinal support ligaments. The other is just saying if you just have disc herniation, this is what you would have. So when I walk into a law office and I say, well, look, this is one of the most significant conditions, and most of the time it's undiagnosed. Now, how do you know? I'm going to tell you right now how you would know if your client has an undiagnosed ligament condition. Because there's 3 ways that you'll be able to tell after this talk. And one of the ways is they have a negative MRI, but they have serious complaints. They have complaints, but they have a negative MRI. Well, what's causing the complaints? Damage to the other ligament. You don't have to have a disc herniation for severe damage to the spinal support ligaments. You can have surgical levels of severe damage and never damage the disc. Plus, you can have levels of severe ligament damage to the support ligaments in areas where the discs don't herniate much. So if I go to C2, C3, that disc does not herniate much. Okay, but I could have a surgical level of that damage in the upper cervical spine. And what would it do? It would mimic every symptom of a mild traumatic brain injury. So if you got a mild traumatic brain injury patient out there whose symptoms are not abating, they're treating with the doctors for so long, oh my gosh, here we go. You just can't get this to abate. These visual disturbances, or these balance difficulties, or these headaches. I get jaw pain. I got TMJ pain. I feel a sense of. I have cognitive difficulty. Seemingly, I'm foggy. And what are those symptoms of? Those are symptoms of an upper cervical ligament injury. So if it's not addressed, they're not going to get better. And unfortunately, when they don't get better, they don't know what to do, so they're drifting. And it's a horrible. I mean, think about this. If a person has headaches, 5 days a week and they last for 4 hours. They have 20 hours a week of headaches. They're going to have 1,040 hours of headaches a year. In 10 years, they're going to have, whatever that is, 10,000 for 40 times 10,400 hours of headaches in 10 years, 10,400 hours, right? When you sit down with a headache patient, just go, okay, how often do you have headaches? And then do the math. If this condition is not resolved, do the math. Now, are they going to have an anxiety or are they going to have some sort of a behavioral disorder? Yes, I would be. I'd be cranky as hell. I'd be moody. Why? Because I can't get any help. I got this condition, I can't get any help. There's two terms for a victim. One is a person's been injured. That's the definition of a victim. Somebody's been injured. They're a victim. The other victim definition is somebody who cannot get out of the circumstance they're in. They're a victim of that circumstance. So the person is a double victim. One, victim of the trauma in the first place, and two, now a victim of the condition that they can't resolve because they can't find a doctor that can resolve it with them. And when I was in private practice, I loved that challenge. I absolutely couldn't wait for that challenge. That's the patients I wanted coming into my practice, right? So what are the other problems though? So if I'm in with the attorneys and I say, all right, this is how you know if you have one of these cases. One, you have a negative MRI, but you have symptoms. That's patient number one, you definitely have this. Patient number two, client number two, you have a client that's under care but is not doing well. And they've had a lot of care, they're not doing well. They have this condition, 100%. Three, you have a condition, you have a client who does not have symptoms that match the symptoms of a disc herniation. So if I have any other symptoms besides pain and radicular complaint, chances are good I have more than a disc herniation, a lot more. So if the person doesn't know that, again, the doctor doesn't know that, there's a delay in diagnosis, and all of this causes a improper workup. It causes an under-documentation. And when you have under-documentation, you have the patient's access to the benefits that they may be entitled to denied. Because your notes, doctors, are what allow the patient access to benefits they're entitled to. So you're key, you're the absolute key to their future, you're the key to their current, to their near future, you're the key to their late future. That's what I loved about being an injury doctor. I loved that level of responsibility. I loved taking on the challenge of, hey, in my office, you're not going to, 55% of the people walking out of my office are not going to be, still have their same conditions 10 years, 17 years later. No way. We're going to minimize that. You can take a permanent condition. If I have a compression fracture, a 10% compression fracture at C5, okay, that's a permanent condition. But the patient doesn't have to suffer with it for the rest of their life. Now, is it a chink in their armor, so to speak? And does it weaken the structure and make it more probable that there's going to be a problem in that area or could be a higher level of problem in that area in the future? Yes, it does. But that's what management is about. That's what management is about. So, the worst thing is when a patient's condition is unknown. And that means undiagnosed, or rightfully, you're not getting to the cause of the problem. That's where you want to be, doctors. You want to be getting to the cause of the problem. And the cause of the problem, oftentimes in the spine, is an undiagnosed spinal support ligament injury. You pick that up with excessive motion testing. And when you're doing the damn excessive motion testing, do it unbiased, do it independent. Don't try to do it yourself. There's too much to this testing procedure. It may seem simple, may sound simple to you. It's not. The systems that deliver it are not. They're not simple. They're not simple to produce. So do it in an unbiased manner whenever possible. And that's my gist of today's podcast. I hope you got something from it. If you have interest in the Smart Injury Doctors program, call us at 800-940-6513 or look us up on the internet, smartinjurydoctors.com. If you want to get more free information, we have a Smart Injury Doctors spinal injury information network. You just go out and look it up, join it, become a member of it. It's free. And we also have a lot of other resources that are out there. So, doctors, I hope, like always, it's given you something to think about. I appreciate what you do, and I look forward to delivering more content with you on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.